Aloha mai kako. I'm very honored that my research was accepted at this special event through Papa'ololokahi. As you can see, the title of my research is Building Solidarity of Indigenous Practices in Primary Care on Molokai. It is a mixed method study, and as you'll see, it is guided by my community, my culture, and just self-determination. I am a doctor of physical therapy, and I have a clinic on Molokai, physical therapy clinic, and an EdD candidate at Mānoa College of Education. I'm excited to share that just a week ago, my research got accepted for IRB approval. So I'm looking forward to share what I have submitted and for you to be able to continue this journey with me. So just some people, and this is something that I really honored from Auntie Manu, Aluli Myers, and we always focus on conflict of interest in Western medicine and business practices, but really showing our statement of relationality. So I stand before you first, you can see I have very strong roots. I move forward because I've been very loved and cared by my family. My parents were born and raised in Pangasinan, but me and my brothers were the first born in America. And so some of these indigenous roots, diasporic indigenous roots, have been sprouting since living on Molokai. So you can see I now live with my husband on his homestead land on Ho'olehua on Molokai, where we do a lot of things very simply to take care of the land so that we can take care of ourselves. You can also see here, I will do things on a national level, being able to advocate for rural health, primary care, in different settings, specifically for the place I call home, Molokai, and which is the people that I serve. And then you can see that I was blessed to be able to connect with Kaukaluli, given that he had his primary practice on Molokai. But my Western roots also are, again, graduated from physical therapy school at University of Pacific in Stockton, California. I also did a residency in neurological rehab, which is called PNF, or proprioceptive neuromuscular facilitation. And I also did a fellowship in primary care musculoskeletal and orthopedics manual therapy. So blending all of that together helps you understand the basis of a lot of my research. You have come across this presentation either because I wanted to share my passion or you've seen my poster. Here's a little snippet of it that you can see. My hope and my goal is to help recover and restore the healing practices that have been hidden, specifically here in Hawaii. Understanding that I was born and raised in America, but in the Philippines, it's been colonized 2 to 3 times over multiple centuries. So to have a context and also look at Papa'ololokahi's historical context and cross-reference it with a few different articles to see the colonization of the Hawaiian healing practices makes it a little bit more tangible, especially because this is the land that I serve. Let's see. So my objectives really in this is to explore restoration, integration of Indigenous healing, to understand the visions for culturally grounded care. 3, document practitioner experiences, and that's more of the Indigenous and Kanaka Maoli practitioners. Assess access to Indigenous versus Western care and examine visibility and support for the Indigenous healing. not again, just for not only for the people, but also for the practitioners that have had to feel shame for hiding. This also, I think, blends with the challenges with Olelo also, or speaking Hawaiian. So my primary research questions are, how are Indigenous practices being restored, valued, and integrated? And the second question is, how do practitioners and community members envision culturally grounded care? The framework that I'm using, the theoretical framework that I'm using, is a two-eyed seeing. I really like this just because I was born and raised in America. I was Western trained before I really started to conceptualize Indigenous practices, but have also learned that the way my family and my parents my family, my parents, my extended family, we really were raised on using herbs, using plants to help in our healing practices. It wasn't until much later in life where I had a little bit more challenging personal medical diagnoses that we really went into hospitals for care besides, the standard expected immunizations. So what I like about this two-eyed seeing is that you need both eyes to be able to see, and it's not about saying one is better than the other, but how do we honor the best of both Western and Indigenous? I came across another article that used this two-eyed framing and had things that came out, which I am using as a basis of my research as well. So declaring positionality, communication of group, interpretations and guiding principles, relationship building, inclusion of Indigenous advisory committees and knowledge holders, continued community guidance, use of traditional gathering techniques, collaborative community involved, and collaborative community involved data analysis and interpretation, and then making meaningful and lasting relationships. So when you look at my poster, let me see if I can go back here. Oh yeah, I have it here. You'll kind of see how I integrate all of this. So talking about the colonization, I use Lainui's 5-step process. So step 1 is denial and withdrawal. 2 is destruction and eradication. 3 is denigration, belittlement, and insult. 4 is surface accommodation and tokenism. And then 5 is transformation and exploitation. So you can see when I first wrote this, I did not come across Popolakahi's historical timeline as well, but I am going to incorporate that into my research. But you can see in the area post 1778 to 1905, the banning of the kahunas or native healers in 1905, surface accommodation of showing how they heal the practices. But after my summer content courses with Derek Tyra, really pushing on looking at primary resources. So I've actually been able to pull out the original documentation showing these 1905 outlaws, these originally the original license documentations in 1919 and 1965. And so again, I'm excited to share these and how even some of the research that has these secondary articles that have been presented can be refined or better clarified to see and show, and again, show the healing of these practitioners, this culture, these people, so that we can move forward with it with honor and dignity. The next thing in decolonization, Lainui's article also talked about, again, being able to decolonize. So there's also 5 steps. So the first step is rediscovery and recovery. Mourning, step 2 is mourning, step 3 is dreaming, step 4 is commitment, and step 5 is action. And here, this is where I'm really pulling in the research. I think the decolonization has been happening. Although finding the research or making it very specific to Molokai, because I think as I've learned the culture of Hawaii and knowing that not only do each island have their own culture, but certain areas of the islands also have their own culture. So I want to honor this in this capacity for Molokai. So again, my study is a mixed methods, and you can see how I have integrated these qualitative, these different aspects of the 2-eyed seeing in the qualitative and quantitative. And so for now, stay tuned. I'll be starting to do my interviews coming August, starting to do all my different coding, starting to put out a survey to the Molokai community by early 2026. Hopefully have all my conclusions and share by next June, July, because I'll be finishing my EdD program and my research by that time. But I recognize that this is just the beginning of lots of research that I want to do to help serve Molokai and my own Indigenous practices that I have been gifted with from my own family. So thank you so much. And you can see here, these are some stickers. Our clinic, Molokai Physical Therapy, does have a little table to help show that we care and that we want to perpetuate this knowledge. And so in one of my classes, summer classes 23 by Dr. Truck Nguyen, Nguyen is Indigenous is not opposite nor derivatives of Western. They are just another kind. And recognizing that every flower blooms on its own time. So stay tuned for more. Mahalo nui loa, and here is the QR code. If you're watching this, you probably already had access to this little Google form, but if you didn't, please take a look, give me any feedback, questions, concerns, if you're interested in anything else or would like to be in any of my presentations as I go through this journey. Again, I'm very grateful for your support. Thank you so much. And thank you so much, Papa Ololokahi, for this moment to share. Pahui ho.